Have you been using over-the-counter dry eye drops many times a day, but your eyes are still dry and irritated? If you're wondering if you're using the right eye drops for your eyes, this is a video for you. In today's video, I'll go over my updated 5 recommended eye drops for the 5 most common types of dry eye disease and help you pick the right eye drop for your dry eyes. Hello everyone, this is Dr. Audrey Tai. I'm a board-certified and a fellowship-trained refractive and cataract surgeon, ophthalmologist, and cornea specialist. Welcome back to Eye Channel for Eye Surgeon. This is the 3rd video of my latest dry eye disease video series. You can check out these 2 videos to learn more about my treatment guide for dry eyes and blepharitis. All of the eye drops I mentioned in this video are free of preservatives, safe to use with contact lenses, and I have listed the links to them in the video description below. If you stay with me until the end of this video, I will also give a bonus tip of my recommended eye drop for severe dry eyes. The first eye drop I recommend is for those of you who have dry eyes from eyelid oil gland dysfunction, aka posterior blepharitis. If your eyes often feel burning and stinging, tear a lot, and your eyelids are itchy and irritated, or you sometimes wake up with crusts on your eyelashes, you may be suffering from both dry eye disease and blepharitis, an inflammatory condition of the eyelid. These 2 diseases often occur together. In fact, studies have shown that more than 60% of people with dry eye disease also have blepharitis. Posterior blepharitis, also called meibomian gland dysfunction or MGD, causes an evaporative type of dry eye disease, meaning the eye loses moisture quickly due to missing the thin oil layer of the tear film secreted by the meibomian glands. You can also develop MGD due to hormonal changes due to menopause or other medical conditions that can affect your systemic hormone levels. To learn more about blepharitis and its treatment, you can check out this video. If you have both dry eye disease and meibomian gland dysfunction, you need to pick a preservative-free dry eye drop that can help replenish and improve all 3 layers of the tear film: the lipid layer, the aqueous layer, and the mucin layer. The Optase MGD Advanced Dry Eye Drops contains 0.9% glycerin as its main lubricant. It also contains sacha-inchi seed oil. A randomized quadruple masked and actively controlled clinical trial published in the Journal of Octa Ophthalmologica in 2020 showed that sacha-inchi seed oil in eye drops improves tear film stability and lowers inflammation on the surface of the eye. Optase MGD Advanced Dry Eye Drops also contain the combination of sodium hyaluronate and trehalose, which are both natural ingredients shown to be very effective in replenishing eye surface moisture and reducing tear osmolarity or thickness. This drop is oil-based, but it comes in a clear, not milky drop. It does not cause prolonged blurred vision and is safe to use with contact lenses. The Optase MGD drop comes in a multi-dose preservative-free bottle that contains 300 doses and has a 3-month shelf life after opening. If you have meibomian gland dysfunction or posterior blepharitis, or suffer from dry eyes due to hormonal changes from menopause or other medical conditions, I recommend you use Optase MGD Advanced Dry Eye Drops 3 to 4 times a day with 1 drop each time. This video is sponsored by Optase, which is a brand of dry eye products that I have carried in my office for my patients for quite a while now. So I'm happy to now be able to partner with the brand I recommend to my patients in my own clinical practice to bring you this educational video series on dry eyes and blepharitis. Number 2, eye drops for dry eye disease from allergies. If you suffer from seasonal allergies or other chronic allergy conditions such as eczema, atopic dermatitis, etc., you are likely to also have dry eye disease, which causes itchy, red eyes, and significant tearing during flare-ups. You may already be using over-the-counter allergy eye drops for those eye symptoms, such as Visine, Pataday, etc. Over-the-counter allergy eye drops typically contain antihistamine and other ingredients that constrict blood vessels. Those ingredients can actually reduce tear production and cause worsening of dry eye symptoms. To learn more about this topic, you can check out this video. If you are suffering from chronic allergy symptoms, I would recommend you try Optase Allegra eye drops. It contains 0.35% of hydroxyethylcellulose as its active ingredient for replenishing moisture on the eye surface. hydroxyethylcellulose cross-links upon contact with tear film due to the pH difference, and this increases viscosity or thickness of the tear film. The eye drop forms a barrier on tear film to shield off allergens, such as pollen. Optase Allegro eye drops also contain ecotine, a naturally occurring compound derives from single-cell bacteria that can be found in the most extreme environments around the world. Think of salt lakes in the Egyptian desert. Ecotine protects organisms against dehydration and creates a water-rich shield to protect the outer layer of the cells from allergens. The Allegro eye drop acts as a first line of defense to stop allergens from entering our eyes, in addition to lubricating our eyes. Number 3 eye drop for dry eye disease after eye surgery. You probably have heard that people who recently had LASIK eye surgery or cataract surgery may feel like their eyes are dry right after surgery. In fact, shortly after eye surgery, due to the surgical incisions on the surface of the eye and the frequent use of medication eye drops that are needed during the postoperative period to prevent infection and reduce inflammation, you may experience temporary dry symptoms after eye surgery. During postoperative period, you want to avoid lubricating eye drops that are very thick or have milky oil component, because a lubricant eye drop that is too thick or has milky consistency may cause temporary blurry vision and may migrate under surgical incisions and cause poor healing of the incisions. You should be using a preservative-free lubricant eye drop that contains ingredients that promote healing on the surface of the eye. For postoperative dry eye disease, I recommend Optase Hyalo Relief Dry Eye Drops. It contains 0.25% glycerin as its main lubricant. Glycerin promotes surface cell growth in our eyes, the epithelial cells, and reduces the osmolarity or thickness of the tears to help spread the tears over the surface of our eyes. It also contains hyaluronic acid. Hyaluronic acid is found naturally in the eye, where it is produced as a response to injury to the surface of our eyes to promote healing. Hyaluronic acid can also reduce mucus strands in our tears. Optase Hyalo Relief Dry Drops are stored in the Hyalo delivery system, an innovative multi-dose drop bottle that maintains sterility over 6 months without the need of preservatives. It dispenses 1 drop with each click, significantly reduces waste, and it does not cause blurry vision after applying the eye drop. You can watch this video to learn more about Hyalo Relief Dry Eye Drops and how to use them. Number 4 is the eye drop I recommend for the most common type of dry eye disease, the mixed type of dry eyes. There are 2 major types of dry eye disease: aqueous deficient type, meaning not enough tears are produced by our tear glands, and evaporative type of dry eyes, meaning the moisture in our eyes evaporates too fast due to the meibomian gland dysfunction, or MGD. Most people who have dry eye disease have some combination of both components. This is why, for most of my dry eye patients, I recommend Optase Intense Dry Eye Drops. Optase Intense Dry Eye Drops provides a long-lasting lubricating effect while not causing prolonged blurry vision after applying the eye drop. It contains 0.2% glycerin and sodium hyaluronate. For most of my patients with moderate to severe stage of dry eye disease, I recommend using the Intense Dry Eye Drops 4 to 6 times a day, along with doing warm compresses twice daily to treat MGD. To learn more about my step-by-step guide for treating dry eye disease at home, you can watch this video. Number 5 is my recommended eye drop for people who find it difficult to apply eye drops. Just like some of my patients in my clinical practice, not everyone can apply eye drops easily. For people with arthritis in their fingers or Parkinson's and many other diseases that may affect their ability to apply eye drops from a bottle, I recommend Optase Comfort Dry Eye Spray. It provides the comfort of drops and the convenience of a spray for those who struggle with applying with eye drops. To use Optase Comfort Dry Spray, press down the dispenser 2/3 of the way, then hold the spray 6 to 10 inches from the eyes, then press down the dispenser all the way. The spray spreads from the surface of the closed eye to the eyelid margins. As you blink your eyes, it will spread over the tear film, where it strengthens the lipid layer of the tears and provide extra lubrication. It contains 1% glycerin, sabothrone seed oil for replenishing the oil layer of the tear film. It also contains sodium hyaluronate to provide long-lasting lubrication to the surface of the eye. Here's the bonus tip I promised. For patients suffering from autoimmune diseases, such as Sjogren's disease, simply applying lubricating eye drops during the day is unlikely to be enough to control this type of severe dry disease. I recommend using Optase Hyalo Nighttime Eye Ointment at night, in addition to using a daytime dry eye drop I recommended above. Optase Hyalo Night Eye Ointment contains white petroleum and lanolin, a natural lubricant, as well as vitamin A. It can provide over 6 hours of moisture retention in the eye for nighttime dry relief, without causing crusting or impaired vision in the morning. Before bedtime, after washing your hands, tilt your head backwards and gently pull on the lower eyelid using a finger of one hand. With the other hand, hold the tube in an upright position above the eye, without touching the tip of the tube to your eye or eyelid. Apply about 1/4 inch of the eye ointment into the gap formed between the eye and the eyelid by gently squeezing onto the tube. Close your eyes gently, then blink normally, replacing the cap firmly back onto the tube. Make sure you do not allow the tip of the tube to touch the eye or any other surface to avoid contamination. If you have severe dry disease or suffer from Sjogren's disease, I recommend using the ointment every night right before bedtime. Let me know in the comments below which of the dry eye drops I mentioned in this video you have tried and what you liked or didn't like about them. I hope you find this video helpful. If you have learned anything new today, please hit the like button and subscribe to my channel to help me bring you more videos about eye health and eye surgery. You can also follow me on Facebook and LinkedIn at Dr. Audrey Tai to learn more about my practice. Thank you again for watching, and I will see you in my next video.